I'm Dr. Nadeem Sajjad Raja. You are watching my YouTube channel, Dr. Raja Nadeem Sajjad Official. In this video, I'm going to talk about postpartum psychosis. Giving birth to a baby brings about many changes, and these can include changes in a new mom's mood and emotions. During this time, the most severe end of change spectrum is a common condition known as postpartum psychosis or puerperal psychosis. This puerperal psychosis or postpartum psychosis can be scary. She may hear voices, see things that are not reality, and experience extreme feelings of sadness and anxiety. These symptoms warrant emergency medical treatment. 1 to 2 out of every 1,000 women experience postpartum psychosis after giving birth. So there are several different entities of mental illness or after giving birth. So the first of all, postpartum blues. An estimated 50 to 85% of women experience postpartum blues within a few weeks. So symptoms associated with postpartum blues, it is also called as baby blues, include tearfulness, anxiety, irritability, quick changes in the mood. Another entity of postpartum psychosis is postpartum depression. So in postpartum depression, these symptoms usually last 2 to 3 weeks, but these symptoms really disturb women's functioning. So these symptoms include consistently sad mood, feelings of guilt, worthless or inadequacy, anxiety, sleep disturbances, difficulty concentrating, appetite changing. A woman with postpartum depression may also have suicidal thoughts. So what is postpartum psychosis? Most doctors think that postpartum psychosis is some sort of severe mental illness. It is not uncommon for all new mothers to have episodes of sadness, fear, and anxiety. But when these symptoms persist and turn into potentially dangerous thought, at that time, that new mother or the family should seek medical help. So what are the common signs and symptoms of the postpartum psychosis? So for example, new mother start hearing things that are not true, such as suggestions for a mother to harm herself or that the baby is trying to kill her, delusional beliefs that are usually related to a newborn, such as others are trying to harm the baby. So new mother is disoriented as to place and time, erratic and unusual behavior. This is very important. Rapidly changing moods from extreme sadness to very energetic. New mother may also have suicidal thoughts, or sometimes she has violent thoughts such as telling a mother to hurt her baby. Postpartum psychosis can be severe for a mother and her little one. If these symptoms occur or persist, it is vital to seek urgent medical help. So, who are at risk of suffering with postpartum psychosis? Women who have a history of bipolar disorder, history of postpartum psychosis in a previous pregnancy, history of schizophrenia, family history of postpartum psychosis or bipolar disorder, first pregnancy. So how postpartum psychosis is diagnosed? So doctor will take the full history of the illness and doctor will also ask about the previous history. For example, if there is any history of depression, any medication, bipolar disorder, anxiety, other history of any other mental illness, family mental history, any thoughts of suicide or harming the baby, use of any uh, narcotic drugs. After the diagnosis, then patient might be admitted for further management and treatment. So there are different management therapies. Antipsychotic drugs, mood stabilizers are given in addition to the supportive therapy. So the doctor expert in this field will start the therapy, and patient should be under the care of specialist and and act upon the advice of the specialist or consultant psychiatrist. So different therapies are tried. For example, as I mentioned earlier, antipsychotic drugs. So in antipsychotic drugs, risperidone or olanzapine and some other drugs are used, and mood stabilizer, lithium, carbamazepine. So one more very effective therapy, when these therapies are failed, then electroconvulsive shock therapy is used, and it is very effective. So thank you very much for watching this video. If you have any question, write down in the comment section. I will answer. Thank you.